With this distinction between health and healthcare in mind, how should that inform our interactions with the healthcare system as patients and individuals?
That's a very important question. How should we access or enter or relate or interact with the healthcare system? Based on my own experience, as being a patient, being sick, and as a doctor, there are three things that I think are really critical. Once you have somebody that is a doctor, healer, nurse practitioner, mid-level physician's assistant, I think you need to have a single person who has some level of competence, and that's hard to sort of judge, but who knows, who's competent in what they do. That person has to have your best interests at heart, has to care for you, and you have to have faith in that person. Those three things have to be competent, they have to have your best interests at heart, and you have to have faith or trust in that person. And that is actually very difficult to get in many circumstances in the United States because we're moving around all the time, our healthcare insurance plans change who we have access to, and people are entering and leaving the healthcare professions in great numbers. So continuity is really tough. So the competence of that person that you seek, and I think it has to be a person, not a system. We relate well to individuals. We don't relate well to a more nebulous system. That person could be a naturopath, they could be a homeopath, an Ayurvedic doctor, they could be a family practice doctor, a nurse practitioner, and within their framework they have to be skilled and competent, and skilled in terms of interacting with people. They have to have your best interest at heart, means that they don't see you as a bunch of organs that will make them money. We have a profit care system in the United States, and everybody in this country is an opportunity to bill somebody to collect some money. And that's a horrible way to look upon healthcare, but since we spend half of the world's healthcare bill and we don't have much to show for it, namely we're not very healthy as a country, that suggests that profit care may not be good for us. The third thing is you have to have faith in this person, because so much of the transaction between your seeking a healer and becoming healed, so to speak, requires your own powers or capabilities to muster your own energy to get well. And part of that is having faith that this person who's trying to help you will be able to do that.